Hello all, my name is Kenneth Huynh, and today I'll be presenting my project that I've worked on for nearly the last years with Polygence in regards to treatments for Huntington's disease. In this presentation, I'll be going over four main topics. The first one is in the introduction. The introduction will go over a basic overview of Huntington's disease on a biological level. Next, we'll move on to the symptoms. The symptoms are what a person has to deal with when they have the disease. Next, the bulk of the project, the treatment section. An example question that could be answered during this section is, what treatments are being used to help cope with the disease, to help improve the disease, to help people live better if they have the disease? And finally, we'll be going over to the conclusion, which is a summary of the disease, its effects, and the treatments. Introduction to the disease. What is Huntington's disease? Let's dive into the disease. A condition that is considered a neurodegenerative disorder that profoundly affects individuals in the supporting cast. Despite its challenges, there are many ways to enhance the quality of life of those affected. The disease manifests in two main forms, adult onset and juvenile onset. The age of onset varies based on certain variables. However, it still shapes the course of the disease and impacts on individuals in many ways. From physical to cognitive and psychological symptoms, Huntington's disease presents a multifaceted challenge. It's crucial to understand the breadth of its effects. The genetic basis of the disease, particularly the abnormal CAG repeat expansion, underlies its progression. This genetic insight informs our understanding of the disease mechanisms and how it came to life. Diagnosing Huntington's disease involves a combination of clinical assessment and genetic testing. It is important to recognize the progressive nature of the disease and its implications on day-to-day activities. Our focus shifts towards managing symptoms and improving the quality of life. Through medication, therapy, and support, we aim to provide relief and support to those affected. While challenges persist, ongoing research offers hope. Genetic therapies and neuroprotective strategies represent promising avenues for future intervention. For patients and caregivers alike, support groups and resources play a vital role. They offer not only guidance, but also empathy and solidarity in the face of Huntington's disease's challenges. In conclusion, Huntington's disease poses a significant challenge, but it's not without hope. By understanding its complexities and leveraging the available resources, we can navigate its impact more effectively. Next, symptoms of the devastating disease. What symptoms are present? We'll explore the profound impact of Huntington's disease on individuals, focusing on its array of damaging symptoms. To begin, chorea. Chorea is a hallmark feature of Huntington's disease, presenting as involuntary, sudden, and irregular movements affecting various body parts. These movements worsen with physical or mental stress, complicating symptom management. Individuals with the disease experience increased muscle rigidity, leading to stiffness and resistance during movement. This stiffness impairs fluid motion and fine motor abilities, hindering daily tasks. HD disrupts swallowing, resulting in dysphagia. This dual challenge not only raises the risk of aspiration pneumonia, but also affects dietary intake. Progression of the symptoms. As HD progresses, coordination and balance deteriorate. Individuals struggle with an unsteady gait, oculomotor abnormalities, and weight loss. Speech difficulties such as slurred words also worsen over time. This impairment poses a significant challenge in communication, leading to the frustration and isolation of those who have the disease. There's also a cognitive decline. HD leads to cognitive decline affecting executive functions and short-term memory. Reduced attention spans and impaired problem-solving skills add to the cognitive burden. Psychological and emotional impacts are also one of the main categories that we'll go to next. Depression, anxiety, and mood swings are all prevalent in Huntington's disease. Aggressive behavior, apathy, and social withdrawal further compound the emotional toll. Some individuals with HE may also struggle with co-occurring mental disorders, adding to the complexity to the clinical picture. The multidimensional impact of HD underscores the need for integrated care approaches. A comprehensive, multidisciplinary strategy is essential to address the wide range of symptoms and improve the quality of life for the individuals with the disease. Now, taking a look at this figure, we can see there is a pyramid of the effectiveness of the symptoms of the disease. At the bottom of the pyramid, we can see this physical. Physical symptoms often occur in almost every case of Huntington's disease, therefore being the most common. Next, we can see that cognitive symptoms appear. They appear later stages of the disease after some time has passed with physical symptoms. Finally, psychological. There's a psychological toll on those impacted with disease late in their diagnosis of the disease, as they have had to deal with the countless struggles of the disease. Next, we move on to the available treatment for the disease. First, we begin with pharmacological interventions. To begin, I would like to talk about a drug called tetrabenazine. Tetrabenazine is a highly effective drug in reducing involuntary movements in Huntington's disease by regulating the neurotransmitter activity. Studies have shown an impressive 89% improvement rate, highlighting its efficacy in managing the motor symptoms. However, there is many ongoing research. Current research efforts focus on developing drugs that target neurotransmitter systems to address mood and cognitive issues in Huntington's disease. These advancements hold promise for addressing the complex neuropsychiatric aspects of the disease. Antidepressants such as amitriptyline, ropapine, and citalopram demonstrate significant efficacy in managing depressed mood in Huntington's disease. Studies report an average remission rate of 30.30%, offering relief for individuals grappling with mood disturbances. The future of pharmaceutical therapies is promising. Early-stage advances in pharmaceutical therapies provide hope for better management and potential cures for Huntington's disease. These developments signify progress in addressing the underlying mechanisms of the disease, offering optimism for the future. To conclude, pharmacological interventions play a crucial role in managing symptoms and improving the quality of life for individuals with the disease. Ongoing research and emerging therapies offer hope for more effective treatments and ultimately a brighter outlook on those affected with the disease. Next, we move on to the second treatment, physical therapy. Rehabilitation plays a crucial role in enhancing the quality of life for individuals affected with the disease, offering a tailored intervention system to address the various challenges and to maintain the physical function while having the disease. Physical therapy is vital, providing personalized activities to address mobility issues and maintaining physical well-being only set out to help those affected. Now, occupational therapy. Occupational therapy complements physical treatment, focusing on adapting daily activities to preserve dignity and independence despite the physical constraints put on by the disease. Interventions like proprioceptive neuromuscular facilitation techniques and rhythmic haptic cueing have proven effective in improving gait and balance in HD patients. While not a cure, rehabilitation is recognized as a powerful tool for lifelong management of the disease, offering a more inclusive framework when physical and occupational therapy are combined. This combined approach not only maintains the physical well-being, but also instills resilience and empowerment, enabling individuals to navigate daily life with respect and autonomy despite the challenges of Huntington's disease. Finally, the last two, mental health and assistive technologies. For psychological support, Huntington's disease deeply affects the mental well-being of both patients and caregivers. Psychological counseling includes therapy and education, offers a crucial support, and facilitates informed decision-making for those with the disease. Support groups. Support groups are a crucial part of this. They play a vital role in providing comfort and fostering a sense of togetherness among individuals facing similar challenges. Emotional expression and coping skill developments within these groups help foster resilience and strength to combat the disease. There are many assistive technologies that help those affected with the disease. Technology offers accessible gadgets tailored to cognitive and movement disabilities in HD. Talking mats enhance communicative effectiveness, particularly in planned conversations, while assistive technologies for cognition addresses cognitive difficulties. As of 2017, there has been limited availability of assistive technology specific to Huntington's disease. However, advances in mobility aids, such as advanced wheelchairs and advanced adaptive appliances, promote independence for individuals with the disease. In conclusion, psychological support and assistive technology serve as crucial pillars in managing the disease, offering hope and enhanced quality of life amid its challenges, while also being connected to the other two treatments. Finally, the conclusion of the disease and treatments. Huntington's disease profoundly affects physical, cognitive, and psychological aspects, impacting approximately 30,000 Americans. On a genetic basis, it is caused by a mutation in the Huntington gene. HE leads to physical symptoms, cognitive decline, and emotional challenges. There are many treatment approaches to this. While there is no long-term cure, drugs like tetrabenazine provide relief from motor symptoms. Physical and occupational therapy aims at maintaining independence and function of those affected by the disease. There's also psychological support for the disease. Psychological support plays a crucial role in maintaining mental health, offering guidance and coping strategies for individuals and caregivers. Assistive devices enhance mobility and cognition, promoting independence and dignity for individuals with the disease. Now, it is important to note that there is ongoing research. Ongoing research offers hope for better therapies and a reduced impact on affected individuals and families. Collaborative efforts among researchers, medical professionals, and advocacy organizations contribute to understanding and treating Huntington's disease. To finally conclude this, comprehensive management of Huntington's disease involves a multidisciplinary approach, addressing physical, cognitive, and psychological aspects through various interventions and ongoing research efforts. Thank you all for listening to this presentation, and I hope you have a great day and learn something new.